On the 18th of October, nearly a month into the Ebola outbreak response, the Minister for Health, Dr. Jane Ruthacheng, and her technical team visited Chiranyi village, Madudu sub-county in Mubende district to engage the communities there on Ebola prevention. This was prompted by reports of non-compliance by the public of guidelines issued on how to prevent the spread of Ebola. The measures included reporting all cases of people with Ebola symptoms to known health facilities. The locals here shared their beliefs with the minister. Meanwhile, this village was the epicenter of the outbreak at the time.
Why don't you take pictures of the sick people you show us on TV so we can confirm that our people have died of a similar disease?
There is rumor that people's organs are being harvested. What do you have to say about that?
So, has this thinking changed? We traveled back to this exact village to find out if the beliefs and perceptions about the infection amongst the public have changed. Fred Majambere is the area councillor. He says beliefs and false perceptions are an issue quite difficult to untangle.
Even us as leaders, we are facing challenges with the public accusing us for conniving with those harvesting people's organs.
When we talked to some people, we found that the section still doesn't believe that Ebola existed in Mubende district.
There is no doubt people died and there were many deaths in this area. But for me, I still believe there is a reason people are dying that the government covered up, which is not Ebola. People normally fall sick and die. How is that Ebola? Does Ebola only kill from one family? We are told that when you get in touch with someone who has died of Ebola, you can contract it. For us, we performed the funeral rites as usual. Why didn't we die?
The disease was there, but now it is over because those who fell ill were taken for treatment and some recovered.
We started educating them about the disease, but some continued to call us liars. Others said it was witchcraft or even cultural norms.
The district officials, including the health education officer, Charles Kawuma, say they are working with partners to keep the communities engaged in understanding the disease.
But I want to thank them. I think they are compliant. Because if they were not, remember after discharging the last Ebola patient, coming to the declaration day, we had gone 42 days. So if they were not compliant, in the middle of the 42 days, something would have happened. We would have got even a case.
We did a lot of work of mobilization and sensitization. Actually, we moved village by village, parish by parish. We had rigid communities, it is true, but we did a lot of convincing and sensitizing to make people understand that Ebola is real. And I must say that our people responded. And that is why you see we were able to attack this enemy within 10 weeks. Because people were responding. Now, these few ones who are saying Ebola is not real and they don't believe, these are in areas which were not badly hit.
We as leaders and other technical people, the health workers, wouldn't fight it alone. The community might have. We needed the community first to accept and know that there is a problem that we are having, of which we did it. We did a lot of sensitization. And all leaders were engaged, even if they are oppositions, even if they are in a ruling party.
The district is still within the 90 days of follow-up and surveillance through which the ministry is expected to address such issues. Mwesigye, NTV.